Hello, ladies and gentlemen, and welcome to our diagramming on the combined female diagram. This isn't going to, in essence, take the picture of the ovary and combine it with the feedback loop that we've learned. If you're looking at page 14 of your notes, it's going to be the combined female diagram. There is a space to draw this. Now, personally, maybe watch the whole thing, then go back and pause and draw what you see, just as I add bits and pieces as I go, so it's much easier to follow along once you have a full picture. So we're going to start in the world of the feedback loop once again. So here we have the brain with the hypothalamus releasing GnRH, gonadotropin releasing hormone, to hit up the anterior pituitary. Now we know that the anterior pituitary will release FSH, which stimulates the ovary to grow the follicle. The follicle will then increase estrogen, which will then start to thicken the endometrium lining. It'll also start developing your secondary sex characteristics, such as widening of hips, breast development, narrowing of shoulders, hair growth, those sorts of things. And then there is a negative feedback to stop FSH. So once the follicle has grown and you have a mature follicle and a ovum is ready to be released, we will stop FSH from occurring. So that's the negative feedback loop. But then we will encourage LH to start secreting, which we call a positive feedback loop. On this side, LH will go to the ovary and tell it to release the ovum from the follicle, which we call ovulation. The follicle then will turn into the corpus luteum, which will then start to increase progesterone, which essentially maintains the endometrium lining. It also will it'll also stop or inhibit uterine contractions, which means that your uterus won't contract. So if you are pregnant, then you will not lose the baby. It also stops your body from releasing another egg because you do not want to ovulate multiple times because sperm can hang out for a short period of time. And if you ovulate a second egg or a third egg, they could be, in essence, fertilized and you could have twins because they'll be born at the same time, even though gestationally they're a couple days difference in age. So if fertilization does not occur, the corpus luteum decreases, so it degenerates, and progesterone decreases, and then you ovulate. You menstruate. Okay, which then is part of the negative feedback loop. But now what we're going to do is we're going to add in the ideas of the different phases that we learned in our menstruation day diagrams, and we're going to add the stages in. So you can see the very first stage is flow phase 1 to 5. Now, again, guys, I know I've said this before, but this is a approximation. Not every female ovulates on day 14. Okay, they actually can ovulate anywhere from day 12 to day 16, 17. Okay, it's really it depends on the person. So these are just numbers that we use that are approximations. So phase 1 to 5. In phase 2, we have the follicular phase, which is essentially days 6 to 13 as we develop that immature follicle into a mature follicle, and we want to make sure that we're ready to ovulate. Phase 3, which is ovulation on day 14, again an approximation, is when we release the egg from the ovary and it travels down the fallopian tube. Phase 4 is what we call the luteal stage, which is essentially days 15 to approximately 28, in which your body is maintaining that endometrium lining, trying to stop uterine contractions and inhibiting any further ovulation. So let's take it and attach it to this. So if you want to go back, rewind, and add kind of that information in, you can, or you can wait because we're going to add a lot more here. So if fertilization doesn't occur, so here we have a lot of things going on. It's that picture of the ovary once again that you've now seen more than once. So what we're going to do is we're going to add in our understanding of where the hormones play part. So for the combined female diagram, you could have drawn the flow chart before and then go back to your ovary picture that you have in your notes and add to this, or you can attempt to draw this as well. It's really up to you. So FSH, which is the follicle stimulating hormone, activates the immature follicles. Estrogen and a little bit of progesterone is released from the developing follicles. Then LH, which comes from the pituitary gland as well, will then cause ovulation to occur, so the ovum releasing. That then causes the corpus luteum to be formed, and progesterone and some estrogen are then secreted. So this is kind of the picture of what it looks like when we're acting the hormones on the ovary itself. Okay, you have this picture already filled out in your notes, so you could just add these lines to it, or you could redo it as a way to practice. But what I would recommend is getting this hormones added into your notes on your picture, as well as making sure you have this together. So this would be your more combined female diagram. So if you have any questions, please let me know and have a great day.